السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 12 in medication and number 29 in Ghaith review. Today we are going to discuss 5 questions from question number 162 up to question number 166. معاكم محمد عثمان يحيى. نبدأ مباشرة. Question number 162. A nurse is giving discharge planning instructions to the parents of a 1-year-old child with acute otitis media. Which of the following discharge instruction takes first priority? The options are number A, administer antibiotics as prescribed. Number B, administer influenza vaccination. Number C, breastfeeding as long as possible. Number D, continue using of peptide. وقف الفيديو هنا واختار الخيار اللي بتشوف الصحيح. The correct option is option number A. ليه اخترنا الخيار رقم A؟ نشوف rational. Acute otitis media is a painful type of ear infection. It occurs when the area behind the eardrum, called the middle ear, becomes inflamed and infected. Immediate antibiotics use seems most beneficial in children younger than 2 years with bilateral acute otitis media, and also in children who have acute otitis media with ear discharge, and also provide short-term reduction for some symptoms of acute otitis media. So the correct option is option number A, administered antibiotic as prescribed. Question number 163. A patient comes to the emergency unit with cough and severe dyspnea. The patient's medical history revealed a diagnosis of chronic heart failure and chronic obstructive pulmonary disease. Blood pressure is 110/70 mmHg. Heart rate is 87 beats per minute. Respiratory rate is 23 cycles per minute. Temperature 37.3 centigrade. Which of the following diagnostic tests will be most beneficial to a nurse to figure out if there is an exacerbation of heart failure? The options are number A, B-type natriuretic peptide, PMP. Number B, arterial blood gas, ABG. Number C, cardiac enzyme. Number D, chest x-ray. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A. ليه اخترنا الخيار رقم A؟ نشوف rational. B-type natriuretic peptide belongs to a family of protein hormones called natriuretic peptide. There are two main types of this substance. Number 1, brain natriuretic peptide, PMP, and N-terminal pro B-type natriuretic peptide, NT-proBNP. Both BMP and NT-proBNP are released in response to change in pressure inside the heart. This change can be related to heart failure or other cardiac problems. Levels goes up when heart failure develops or gets worse, and levels goes down when heart failure is stable. So the correct option is option number A, B-type natriuretic peptide. Question number 164. A 4-year-old girl was playing outside. She came to her mom crying and holding her right upper arm. She went to the hospital with swelling over the upper arm, pain and itching. The appropriate management is number A, maintain patent airway. Number B, administer subcutaneous epinephrine. Number C, prepare for intubation. Number D, none of the above. وقف الفيديو هنا واختار الخيار نشوف سهل. The correct option is option number B. ليه اخترنا الخيار رقم B؟ نشوف rational. Epinephrine is used in emergencies to treat very serious allergic reaction, such as insect stings, bites, food drug, or other substance. Epinephrine acts quickly to improve breathing, stimulate the heart, raise a drop in blood pressure,
reverse hives, and reduce swelling of the face, lips, and throat.
So the correct option is option number B, which is administer subcutaneous epinephrine. The dosage is based on medical condition, weight, and response to treatment. Question number 165. An older adult client with renal failure comes to the emergency department with a report of nausea and vomiting. The client's heart rate is 45 beats per minute. The nurse is most concerned about which medication that the client takes. The options are number A, nitroglycerin, number B, digoxin, number C, dexorubicin, number D, furosemide. وقف الفيديو هنا واختار الخيار بالشوف سهل. The correct option is option number B. ليه اخترنا الخيار رقم B؟ نشوف rational. Digoxin is a medication used to treat various heart conditions such as atrial fibrillation, atrial flutter, and heart failure. It may rarely cause other type of irregular heartbeat such as too fast or too slow heart rate. Accordingly, the nurse is most concerned about the digoxin because it may cause irregular heartbeat such as too fast or too low. So the correct option is option number B, which is digoxin. Question number 166. The nurse is caring for a 60-year-old in the medical surgical unit. On entering the room, the nurse finds the patient alert, oriented, and the skin color appears healthy and pink. The nurse observes electrocardiogram and notes absent P waves. Which initial action is the most important? The options are number A, defibrillate, number B, epinephrine, number C, pacemaker preparation, number D, intravenous amidron. وقف الفيديو هنا واختار الخيار بالشوف سهل. The correct option is option number D. ليه اخترنا الخيار رقم D؟ نشوف rational. First line treatment of ventricular tachycardia in a client who is hemodynamically stable is the use of antidysrhythmics such as amidron, lidocaine, and procainamide. So the correct option is option number D, intravenous amidron. Defibrillate or defibrillation is used with pulseless ventricular tachycardia. Epinephrine will stimulate unaltered excitable ventricular and is contraindicated in this situation. Pacemaker is used in sinus node dysfunction and high-grade atrioventricular block. So the correct option is option number D. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.